it was great talking today a little bit more about snapshots versus stories, really trying to understand the whole picture of a patient and not just the snapshot of an MRI or, a pain scale, and really trying to get tidbits of their story to better understand kind of what their life is and how to help them get back to reach their goal and get back to the life that they really want to live.
When you were describing that, I thought to myself, medical education is snapshots.
Totally.
Practice is stories.
Yeah.
And when you're a resident, you are there for the surgery and not there for the follow-up.
Mm-hmm. But
in clinical practice, one of the joys of clinical practice is to truly be involved in that patient's story.
That's been one of the most gratifying parts of finishing residency, coming out, and really just seeing that whole timeline of, I'm hurting, this is a diagnosis, this is how I think we can help you. You perform surgery if needed, and watching them get better and getting their lives back, like, so gratifying. I know it's supposed to be all about the patient, but certainly we get, something out of it and have that great feeling of knowing that we're helping someone get better.
Mm-hmm. And we talked a little bit about how there's an exchange of that where we get to know the clinician as patients, and then the patients get to know us, and we get to know them and their story, and there's an exchange there. It's not as transactional as going to Trader Joe's, even though they kind of want to know your story too.
Yeah.
And maybe sometimes the patient just wants to get in and get out and get an answer.
Mm-hmm.
But I think most of the time, patients are interested in that emotional exchange, and we want the patients to get to know us in a way. We're humans too. We're people trying to help.
Totally.
We're not perfect.
Yeah.
We do care about them.
Yeah.
And I'll tell you, from my experience, when you have context in the patient's story, what is actually going on,
mm-hmm.
it makes the clinical medicine that much more meaningful. And I think it actually guides our choices for clinical decision making, because
mm-hmm.
we can say, well, yeah, it makes sense to do this now. The MRI looks this way. Medically, this is the decision. But then in the context of, I can't take care of my elderly parent.
Mm-hmm.
Okay, let's talk about that.
Yeah.
Why are we gonna put you through a surgery or whatever? And
mm-hmm.
and maybe it's actually surgery doesn't make sense at this point.
Right.
So the patient's willingness to share with us the reasons for seeking care and what their goals are,
mm-hmm.
I think becomes a critical part of taking care of them.
Totally. I think when we understand the big picture, it really helps us make better decisions, and then these better decisions help us have better outcomes, which is what we all want.
Yeah. It's been a few months now since you've been in practice.
Yeah.
What's been your impression so far? Are you disappointed, happy,
no,
terrified, all of the above?
All of the above. It depends on the hour. It's just such a time of growing. I shared a post on my Instagram this week how it really felt similar to my first year of residency. You're just, everything's new, and even though it doesn't seem like it should be new, it is. There's a lot of new parts. A lot of new moving parts, and the mantle of responsibilities all on you. As the neurosurgeon or the attending neurosurgeon. That when you're a resident, it's on the boss. On your attending, and you just kind of chat with them about things, but ultimately they take the responsibility and make the decisions, but now it's all on you, so it's a little nerve-wracking, but I think you just rely on your training, and I try to rely on my good training and make good decisions, and even talked about it a little bit today. When in doubt, I think I always ask myself, what is best for the patient here? Not what's fastest, not what's easiest, not what's, anything financially related. Really just sit back and say, okay, what's best for the patient in this scenario, even if it takes an hour longer or 2 hours longer in surgery or another test or something like that. I think that's kind of been my guiding question that's really helped me just kind of stay focused on the patient. Let's see how we can help them. And I think that'll pay dividends for the future.
That's good. I've always kind of similar sentiment. What would I do for my mom or dad?
Totally.
But I think it's the same. What's the best for the patient?
Yeah.
You mentioned in the conversation this morning how we met many years ago.
Yeah.
And have been exchanging text messages, phone calls. You've come out to the Sundance conference for several years. And all along, I'm like, this guy's character is awesome. He's a great person. Gets along with everybody.
Thank you.
And then, but what you never know for sure is, can he do surgery?
Yeah, well,
and
still learning.
I am too. But I will tell you, you're off to a great start. And there was a neat moment in one of your first cases. You were underway, and I did a similar surgery in the other room, actually the exact same surgery. And I probably started a little bit before you did, and walked into the other room, took one look at the microscope. You were wrapping up, and I knew, he knows what he's doing. And that was a neat moment for me. Like, this guy has the personal character that you would want to have in your neurosurgeon and also in your neurosurgical partner, and also the technical skill set that you would want to have in your neurosurgeon and in somebody that you're entrusting patients to, and all of that. So really happy to have you. Oh,
thanks. I'm so happy to be here, and you've really been a great mentor and a good teacher, and looking forward to many more years to come.
Me too.
Yeah.